Borderline personality disorder, also known as BPD, by Dora Vang. BPD is a mental disorder with signs and symptoms including intense fear and frantic efforts to avoid abandonment, periods of stress-related paranoia, pattern of unstable relationships, such as idealizing someone and then suddenly believing that person doesn't care or is cruel. This is also known as splitting. Experiencing rapid changes in self-identity, such as seeing oneself as bad, engaging in impulsive and risky behavior, as well as suicidal behavior or self-injury in response to fear and rejection, having ongoing feelings of emptiness and intense mood swings, and also inappropriate and intense anger, such as losing their temper or engaging in physical fights. Some causes and risk factors include brain abnormalities. So research has shown that changes in certain areas of the brain involved in emotion regulation, impulsivity, and aggression occurs in individuals with BPD. Hereditary predisposition. There is a higher risk if a close relative has the same or a similar disorder. Childhood trauma. Many people with this disorder report being sexually or physically abused or neglected during childhood. Some have lost or were separated from a parent or close caregiver at a young age. Some also were exposed to hostile, conflict, and unstable family relationships. Diagnosis of BPD involves a thorough interview with the client, a complete medical exam, consideration of family history, and recognition of co-occurring disorders that make it difficult to diagnose and treat. Some complications include comorbidity with other mental illness disorders such as depression, substance misuse, anxiety disorder, eating disorder, bipolar disorders, PTSD, and ADHD. Clients can also experience repeated job changes or job loss due to these symptoms. They might engage in self-injury such as cutting or burning and therefore experience frequent hospitalizations. They might also be involved in abusive relationships and unplanned pregnancies due to impulsive and risky behaviors. Let's take a look at our 3 different first-person sources. In the following slides, I will be sharing the stories of Sammy, Andrew, and Anne and their lived experience with BPD. First, meet Sammy, who is diagnosed with BPD. She refers to her upbringing as a chaotic childhood. Her mother was also diagnosed with BPD. However, her mother never sought treatment, misused drugs, had unstable housing, and often left Sammy to take care of her younger sisters. Sammy experienced a loss of identity, fear of abandonment from family, boyfriend, and friends, experienced splitting and dissociation. She was also misdiagnosed with bipolar disorder 2 different times before being correctly diagnosed with BPD, which led to her taking wrong medications. Sammy was a registered dental assistant for 7 years. She changed jobs every year due to poor relationships with coworkers and doctors. After quitting, she was bedridden for 8 months because of the stigma with having BPD. She read what people thought about it online, which solicited a crippling effect on her different roles and occupations. In the video, Sammy reports that she has been receiving therapy, which has helped her to practice positive thinking. She mentions her strong support system, which includes her boyfriend. He is able to help her break down what she is feeling and de-escalate her intense emotions. She also mentioned that she is 3 months self-harm free, and that is something she is extremely proud of. And lastly, a key aspect in her experience is her level of self-awareness early on to seek treatment. Sammy wanted to live a different life from her mother because she knows that BPD also affects the people you love around you. She is now very vocal about her condition and encourages others living with BPD to seek help because there are resources out there. Next, meet Andrew. He is a husband and a father of 2 boys. He has a good job and a nice home, as he would say. He mentions that people always thought he was outgoing and approachable. However, Andrew was experiencing a loss of sense of identity, or in his words, being who other people wanted me to be. He would feel emotions with high intensity that often led to self-harm, such as cutting. It gave him a sense of relief. He also often had physical aggression where he would slam a glass cup on a coffee table because someone on the phone made him upset. He also experienced irritability and lost connections with family members. He had a career in publishing, but that imploded once these symptoms began. There were times when his wife perceived him as manipulative, even if he did not realize it. He would seek ways to avoid dealing with emotions and trauma, which led to an infatuation with suicide. He has had multiple suicide attempts, such as standing in front of a moving subway train. In Andrew's situation, psychotherapy was impactful and helped him identify triggers during interactions. He also said that acknowledging the physical components of BPD, such as having an overactive amygdala that alarms the individual as something more dangerous than it really is. This helps him understand that BPD is a real illness and not just that he has emotional problems. Family participation in therapy is important and was very beneficial in Andrew's situation because his wife was very willing to support him and played a proactive role in helping Andrew return to activities that were important to him. Experts from this documentary stated that BPD is also known as the good prognosis diagnosis disorder because people do recover from this disorder and go on to lead normal lives. Hence, relapses are not common. Lastly, meet Anne. She was diagnosed with BPD and post-traumatic stress disorder at 18 years old. During her angry episodes, as she refers to it, she felt like she is not in control of her body. Her father was deported when she was 8 years old, and her mother lied to her for 2 years that he was working and that's why she didn't see him at home. Her mother eventually sent her to live with her father in the Philippines at 14 because her mother felt like she could no longer look after Anne. They had a difficult relationship. In the Philippines, Anne experienced physical and psychological abuse from her father, and she was also sexually assaulted by a friend of her cousin's. Her childhood trauma led her to misuse drugs since her early teens. She also engaged in self-harm, such as cutting, which she now has tattoos covering up those scars, but she still feels embarrassed when others look at her scars. She committed suicide 3 times and wanted to kill that angry part of her, as she would say. And even after a difficult relationship with her father, she still desired for affection from her abusive father. Anne's success in overcoming her trauma lies in her self-awareness. She still describes her past and feel like she is psychotic, as if it was a different person. In one of her experiences, she met adults who were living unhappy lives with drugs, and she was afraid that it would be her future. She immediately sought treatment for this and for using methamphetamine. She also states that she has a son and she wants to live a better life for him. And after her parental trauma and resentment, she recognizes that she still wants a relationship with her father. Here are some key points to consider when working with clients with BPD. We must remember that there is no single story to a mental illness. Even if symptoms in clients fit the profile of BPD, OT should consider that trauma and triggers are unique to each client. Also, research shows that there is a need for early diagnosis of BPD in children. Some clinicians are reluctant to diagnose BPD in younger people because detecting personality abnormalities is challenging. An early diagnosis allows for early and preventive intervention and appropriate treatment for young people. Next, OTs in all healthcare disciplines should consider how a misdiagnosis can negatively affect a client's quality of life. If we increase the knowledge of personality psychopathology, we can reduce misdiagnosis. Finally, it is important to train culturally relevant clinicians who are knowledgeable in psychotherapy to administer treatment that the client can relate to or it can hurt their prognosis. After learning about Sammy, Andrew, and Anne's lived experiences, I was able to put a face to this disorder. I have heard about it before, but never really deep dive into the challenges that exist every day for individuals with borderline personality disorder. Here are my references, and thank you for listening.